Welcome to Health Vision, WOUB's program on medicine and health. I'm your host, Jackie Wolf, Associate Professor of Social Medicine at Ohio University. Today's show is the second of a two-part series on ADHD. Last week, we talked about the causes and symptoms of ADHD, and today, psychologist Fred Krieg, Program Director of the School Psychology Department at Marshall University, well-child nurse coordinator Sue Meeks from Ohio University, and Roger Wilkens, Director of the Dogwood Center for Self-Development, are back to talk about the treatment of ADHD. Welcome back, all of you. Fred, is there a cure for ADHD? I see you chuckle a little bit.
I did have to chuckle there. No, there is no cure. I remember, though, when the original 2020 program came out after the Zomotkin research that we talked about.
What year was that?
1991. People would call my office and they would say, "Do you give out the pill that makes kids learn?" And I thought, well, I wish it was that simple. No, there is no cure, but there are treatments.
Okay, let's talk about treatments. And I know the oldest treatment, and probably the most well-known one, is Ritalin. That's the one I certainly have heard about the most. Tell us a little bit about Ritalin. And when you talk about it, I know Ritalin is a very powerful stimulant, which seems like kind of counterintuitive. How can a stimulant subdue what seems to be very out-of-control behaviors? So explain some of Ritalin's history and how it works.
Well, let's talk about psychostimulants rather than one particular one, but let's get them in the category. You're talking about Ritalin, Dexedrine, Adderall, which is a combination of Dexedrine, Concerta, which is a combination of Ritalin, are the kind of major medications that are used. They are all in the category of what we call psychostimulants. The oxymoron is that you use a stimulant to calm down behaviors, because what we know from the brain research is that these psychostimulants increase the flow of the neurotransmitter in the frontal lobe of the brain. And although they only work for a short time, and the problem has been to extend their work, what they will do is increase the flow so that there's enough neurotransmitter to make the frontal lobe work more efficiently.
And as you described last week, that's the problem with ADHD. Describe that again very briefly, that the children or adults are not receiving things properly.
The information comes down the nerve as an electrical impulse. It is changed to a chemical, and there are 11 neurotransmitters in the brain. As it passes through what's called the synapse, and as it goes out, the information goes out. People who have ADHD do not have enough of that neurotransmitter in that synapse. When you give a psychostimulant, it's almost like putting an injection of ink into a fish tank. It'll shoot in the neurotransmitter, and it'll work for a while, but then if you look at the fish tank 4 hours later, you can hardly see that blue ink. What they've worked on is getting these psychostimulants to work longer, which is where Adderall and Concerta, which are longer acting Ritalins and Dexedrines.
And those are newer medications. So that's the difference of these medications. Some are longer acting and some are shorter acting.
Yes.
And part of the problem was you had the image of children lining up for their medications in classrooms because Ritalin was so short acting, they had to be medicated in school. But with the longer acting ones, they do not.
Well, sort of not. It's better. They don't have to come as often. But although they're advertised as working for 8 hours, many children will get a 7 a.m. before the bus comes dose and maybe one after lunch. But certainly it isn't every 4 hours like it used to be. It'll last longer. It's better.
Do these medications work differently in adults and children, or the same?
It's a very good question. They work relatively the same. In adolescence, because of other hormonal things, it's just, we know more about how it affects children than we do adolescents and adults. It's a very difficult question to answer about exactly the same. There are many people who are very opposed to giving psychostimulants to adolescents, and so they will work on the neurotransmitters by using different medications, SSRIs, for example, and serotonin selective reuptake inhibitors, so that they can increase the neurotransmitter staying in the synapse.
And those are antidepressants.
Yes, but they are often used as a second line of defense in treating attention deficit hyperactivity disorder. I'm not a physician. I don't want to go beyond my level of my training. But we will frequently see children who are given a psychostimulant and an SSRI together in order to reduce the amount of psychostimulant they get and also to even out the treatment effect. There are lots of things being done with medicating both children and adults for attention deficit hyperactivity disorder that vary depending on the treatment philosophy of the physician.
So let me ask you, you mentioned in the last show that you have a son with ADHD. And I'm curious just about your experience, not as a professional, but as a parent, and what that was like, and what the, if he, I don't even know if it was medicated, but if there were medications, what that was like, how he reacted to it, and how he reacted to a diagnosis like that. What was that experience like for your family?
Well, this was back in the 70s, so things were a bit different then than they are now, but he was diagnosed with a hyperactivity. There was a lot of issues about, there was a very difficult birth, and then they thought it was minimal brain dysfunction. That was a name for it then, but the treatment was still Ritalin. And we took him to a psychologist, and he was evaluated. And the first time he was on, we tried Silert, which didn't work, and now I'm glad because the information about the liver problems that they've had.
And what was Silert?
Silert was a different medication. You probably know more than I do about that.
It was magnesium pemolate, and it's hardly ever used now because it caused liver complications. So it was the first long-acting psychostimulant. However, really came into disfavor when they found out it caused liver problems over time.
Right. So that didn't work, and the doctor then decided to try Ritalin, and it was the very fast acting. So it would peak in about an hour, and then it would be gone in 3 hours. And so there was just this up and down roller coaster where he would go from being very focused and almost shaky, and then when the meds would wear off, he would cry, and I couldn't do it. I couldn't allow him to be on that medication. And
it's heartbreaking. How old was he then?
He was 6 or 7 then, had started into school, and the school was the first one who said, you know, he's having problems, he can't focus, he's disrupting class. And, you know, of course, looking back, I was a very young, not young and dumb mother is what I say. I was very young. And really just didn't have a clue what I needed to do for him. But he wasn't on medication. He was bright enough to compensate and get through school more or less. But what I found is he ended up choosing things to do that was complemented by his ADHD, always on the go kind of thing. So he's doing quite well. But he would have, I think, done much better in